Okay, so basically phytotherapy has a role in treatment of kidney stones, and I put a question mark, does it? So, do you see the slide now? Move it?
Yeah.
Okay. So, in the last couple of years, I have been requested by a number of journals to do some review, and this was I reviewed last year for this Chinese journal on clinical trials of herbal medicines. So here is the one thing that I would like to emphasize here is that I have this thing. There is a common name, the dose, the duration, the study design, the sample size. But the biggest issue that you see is they were looking different trials. They have been done, as actually Danny was pointing out, Philanthropus neuri is the most commonly done. But if you look at the risk factor that they examined, just look at the tick mark and you will notice it that all these studies, one of them was basically looking at the reduction in stone number and size, but the others parameters, some of them will do it, the others will not. And that is the biggest problem with most of the studies. So all these clinical studies that have been performed, they have followed different protocols for preparation of herbal extracts, the delivery, and look at different outcomes. The other part that I found it interesting was most studies do not identify the stone type. They just say kidney stone patients, and that's it. No mention of what kind of a stone it is. Then what is there in these herbal medicines? There is very limited knowledge of the bioactive components. Then the other part is this: do the ingredients that are known have any effect in vivo or in vitro studies, or do they actually end up in the kidneys? There is no mention. How do they know that this medicine is actually getting into the kidney, and what part of the ingredient is getting into the kidney? And then the effect of extraction and delivery protocol on active ingredients is totally unknown. And I think people who read Kidney International and other journals may have known that some herbal medicines can be nephrotoxic. So I think Danny just mentioned this particular study, Herbal Medicines for Urinary Stone Treatment, a systemic analysis that was published in Archives of Italian Urology and Andrology in 2016. Their major conclusions were there are a plenty of studies on herbal treatment of kidney stones. Lack of information on stone composition, exactly what I mentioned and I found in my review. Considerable variation on excretion rates of risk factors. Some of them, of course, tried to find out what the citrate level was, the most common thing, but all of the studies did not look at it. They didn't even look at the pH. Inability to recognize the active ingredients in herbal preparations. Herbal products did not show any effect on the metabolism that can affect the risk factors. General concern about the herbal medicine is most herbal traditional therapies are self-administered without consideration of dosage, timing, etc. That people just go to the stores and buy, and they are self-treating. Herbal or traditional medicines are often considered natural and may be taken along with pharmaceutical drugs without any thought of drug interactions and negative repercussions. Some herbal medicines contain heavy metals and toxic substances. Some are adulterated with unlisted compounds. Production of most herbal medicine is unregulated. Sometime may be inadvertent or an easily available plant is used to replace the actual medicinal plant. That is, I was actually surprised to see this part of it, that it will say this ingredient is coming from a specific plant, but if that plant is not available, they will put a replacement. For example, in a weight loss preparation in Belgium, Stephania tetrandra was replaced with Aristolochia fungi. Later contains aristolochic acid, a nephrotoxin. Another one is Podophyllum imodi, was replaced with Gentiana species, resulting in liver, gut, kidney, and neurological injuries. Then the issue with the herbal products is many of the herbal medicines contain toxic material of animal or plant origin, some deliberately. Aconite root, a hepatotoxin, but was found mixed in some Chinese herbs with no mention on the label. Poisonous secretion of Asian toads that have digoxin-like effect on heart have been known to be added to herbal medicines. The reference is there. Heavy metals can be essential elements in some herbal medicines. A California study of 251 herbal products found arsenic in 14%, mercury in 14%, and lead in 10%. The reference is there. Many contaminants can be added when plants are treated with banned pesticides or cultivated in polluted environment. That's also a major concern, depending where the plant is coming from and how many pesticides they have used and what kind of fertilizers they have been using. The other aspect is adulteration with pharmaceuticals. Prescription medicines are apparently added to increase the efficacy of herbal products without providing information about their presence. Pharmaceuticals reported to have been found in herbal products include antibiotics, antihistamines, corticosteroids, aspirin, etc. And the references are there that addition of such compounds in undisclosed amounts have obvious risks. Then there is interaction, as I mentioned earlier, interaction between herbal and conventional medicines. According to many reports, patients do not report using herbal supplement, etc. to a physician. So basically, a lot of these patients, they will first start using the herbal medicine, then when the condition gets worse, they go to see the physician, and even though they do not mention to the physician what else were they using, or they continue using this. There is a potential for adverse drug interaction between prescription drugs and herbal over-the-counter, supposedly natural products. The emphasis is on the word natural because people think it is natural, so it cannot be bad. Herbal medicines may increase or decrease serum levels of prescribed medicines. According to American Society of Anesthesiologists, herbal medicines should be stopped 2 weeks before surgery. So that is the case, but it may or may not happen. Herbal products may alter results of laboratory tests. So the concern with the herbal medicine, most herbal or traditional therapies are self-administered without much consideration about dosage, timing, etc. Self-administration and easy availability may lead to incorrect use. Herbal or traditional medicines are often considered natural and may be taken along with pharmaceutical drugs without any thought of drug interactions and negative repercussions. Some herbal medicines contain heavy metals and toxic substances. Some are adulterated with unlisted compounds leading to serious consequences. And production of most herbal medicine is unregulated. So the biggest issue is not in my mind, because I have myself have studied this, some of the herbal products in animal studies, that the problem with the herbal medicine is not that it may or may not be helpful in treating kidney stone. The problem is it is completely unregulated. So we don't know the name of on the label may be saying something, but it may not contain it and it may be dangerous. So thank you very much.